Do you have a partially torn ACL and you're considering your options and what to do next? This video is going to be perfect for you. My name is Dr. Garcia. I'm a physical therapist and the CEO and founder of Sports Performance Physical Therapy, where we help people just like you overcome these aches and pains and get back to the life that you want to enjoy. If you have a partially torn ACL and you're considering what your options are, there's three things you have to consider. And I wrote those down here. Number one, you have to consider what your current activity level is and what it will be down the line. If this is your first ACL or your second to ACL and you have a re-tear or it's the opposite leg, the same questions exist. What do you expect to do when you are 20 years from now? Do you expect to be skiing? Do you expect to be playing basketball? Whatever choice you make will decide should you have surgery or not. And this is a question that no one can answer except for you and the surgeon, most importantly you. You have to consider what your current activity levels are and what they will be in 20 years. Now, the long-term goals. Anytime that you are considering should I not or should I do this, an ACL allows or prevents the shin and the thigh bone from separating from one another. And what that does is provides protection, and that joint is nice and locked in. And when you tear your ACL, you no longer have that seamless lock or stability. And so when you now have a situation where you have a partially torn ACL, there's a little bit of a stretch, which means there's a little bit of a give, a little bit of wiggle room. And now every time that you stretch it, if you're turning and pivoting one direction, you feel it shift is the term. If you feel that shift, what now is happening is those two bones are rubbing together and you have something called cartilage on the top of those joints. And that now makes that cartilage wear and tear, and that rubs it down just a little bit every time that you shift or you pivot or you feel that instability. So if you're feeling that shift on a regular basis, it might be a situation where you might consider doing this because in the long term, you're gonna wear down that cartilage. So number one, figure out what your activity level is now and what it will be 20 years from now. And is it important for you to get this surgery or to just let it be as a partial ACL tear? The second one, as I mentioned, is the long-term benefits, the long-term goals of being able to do this. Do you want your cartilage to be pristine and or you not having those shifts? What is it that is blocking you? So think about those two things. And the last one is, how much does this affect your daily life? Does it affect it only a little bit? Is it that you aren't very active and this was just a rare occurrence? If that's the case, maybe surgery might not be indicated for you. These are all situations that we explain to all our clients here at Sports Performance Physical Therapy. We'll go through all of these scenarios and to help you make a better decision, because no medical provider can do that for you except for yourself. You have to consider your options, especially with the partially torn. Now, I can't tell you if it's 25%, 50%, or 75% torn. These same questions exist. Do you want to be active? Do you want to play soccer with your kids? Do you want to be able to ski? Do you want to be able to snowboard? Do you want to be able to do these things in the long term? Now, what are the long-term goals for you? Do you expect to be active? If you're not, and you're not getting any shifts or pivots, or you're not having a point where you're doing all these things, then this is an opportunity for you to think, maybe I don't need this surgery. And the last one is, how much is it affecting your daily life? And if it's not affecting your daily life, maybe you don't need it right now, maybe as you become more active. These are all things to consider. And once you put these three things together, write them on a piece of paper, review them with several surgeons. And my recommendation is to look for three surgeons. Three fantastic surgeons. Do all the research possible. Once you go through that, you'll find out who fits the profile the best. Who do you trust? Who's the person that you would put your knee in their hands so that they understand who you are, what your goals are, and what your targets are. Once you've identified these three things, bring all these three answers to all three surgeons and allow them to help you make that best decision for yourself. So good luck along your journey, and make sure that you've made the right decision for yourself, and take your time and find that right person for you. Good luck.